My name's Victoria Trainer. I'm Associate Professor in the School of Nursing, Midwifery and Indigenous Health at the University of Wollongong, and I'm Associate Professor in Rehabilitation Continuing and Aged Care, and I'm also an Associate Director for the Dementia Training Study Centre, which the University of Wollongong hosts. At University of Wollongong, if you come as an undergraduate student and take any of the healthcare subjects, you will be taking aged and dementia care topics. And nationally and internationally, that's quite rare. So we're providing an environment in which we're contributing to a workforce that is fit for our population.
Hi, I'm Kath Burns and I'm a first year nursing student.
Hi, I'm Laura Hawkins and I'm a first year nursing student as well.
I'm Phoebe Berlick and I'm a first year nursing student too.
Hello, I'm Isabel Davies and I'm a second year nursing student. I think the most compassionate people are drawn to nursing because they want to help people. But like being able to handle the blood and feces and everything makes a difference too.
Takes a bit of getting used to.
It does take some adjusting.
Once you get over that.
Yeah. Once you've dealt with it a few times, then you're fine.
To work in aged care, I think it's like people you're drawn to a certain thing. Either you're drawn to aged care and you can connect with older people, or you can't.
Yeah.
And I think it's something that you can be enticed into doing. It's either you want to do it or you don't. Same with nursing, really. You're either cut out to do it or you're just not.
Like a lot of people dropped out in our first year. From our classes and our shoots and stuff, like a lot of people dropped out because of the first placement they went on. They just didn't like the aged care that we had, because everyone did aged care for the first placement. Or not everyone, but quite a lot of people did, And loads of people dropped out after that because they just didn't realise how
It's different
intense it is. Yeah.
Any expectations you have, it's more than that. It's so very full on and confronting, just right on that first couple of days.
Yeah.
Thrown into the deep end.
We recruit for a Bachelor of Nursing programme, and a proportion of those will then go to work in aged care. We offer specialised postgraduate programmes, either in gerontology and rehabilitation studies or dementia care. Now those programmes have been created, were launched in 2007, and ever since they were launched we've had a good number of students enrolling on those programmes and graduating. So already in the Illawarra we've contributed to a huge increase in specialist practitioners working in emergency, in nursing homes, acute sectors like medical surgical nursing, people working as community practitioners. We also actually recruit international students to those programmes. We've got people who have taken up positions as a nurse practitioner, and there's only a handful of those in Australia and not many internationally. So we're actually contributing to creating this specialism in aged and dementia care from University of Wollongong.
I'm Christina Foster and I'm doing a Bachelor of Nursing at Wollongong University.
Hi, I'm Timothy Beck, and I'm doing a lot of the younger students in our year. They're here, they've just turned 18, they've got this whole outlook of nursing. They've just sort of skipped over aged care, even though that's a very important part. Australia's an ageing, and we obviously need nurses there, but a lot of them just...
If you go into your average hospital anyway, the majority of the patients, they are of an aged age. I think no matter what area you go into in nursing, you will have to deal with elderly patients.
The most important thing for our programme is that the content and the activities meet the needs of our workforce. Now we know that the aged care workforce is a workforce that has probably not done any education for 20 years even. So what you need to do with your postgraduate programmes is make sure that they're fit for purpose and that they actually contribute to improving practice. So that everywhere the older person interacts with a health service, there's somebody in that team who knows about the special needs of an older person. And we want to make sure that there's a minimum competence among practitioners, so that's their knowledge, their attitudes and their skills for caring for older people and delivering aged care services. So we all need to think about how we can actually make society a good place for older people so that they can thrive and we can actually appreciate their contribution to society.